just had this conversation with a patient about diabetes versus HIV. Which would they prefer to have? I mean, not really prefer. But the interesting thing is that in 2019, it is so much easier to treat HIV than diabetes. In fact, I tell patients that HIV, if untreated, is one of the most terrible diseases that we can imagine. But if you treat it, people can probably live a normal lifespan. We know what causes HIV, and the medication we have to fight it is quite effective. But diabetes, we don't know what really causes it, and we're really treating more the effects of diabetes than diabetes itself sometimes. And it requires behavioral modification on the part of the patient, dietary changes, that sort of thing, which many people can't do. And diabetes can have terrible consequences, like cardiovascular disease, amputations from peripheral vascular disease, kidney failure, that sort of thing. So diabetes is a terrible disease. In fact, I hate it sometimes because it's so hard to treat. But HIV, oddly, is so easy to treat. And these days, you can treat it with one pill for many people. So in answer to the question about that, I think in some ways I prefer treating HIV than diabetes. I've been treating people with HIV since the early 1980s. And by coincidence, my career started when HIV began. So I was an intern in family practice in 1981, and shortly thereafter, I started in June of 1981. Shortly thereafter, there were the first reports of this unusual disease, which came to be known as HIV/AIDS. I had no idea that I'd be involved with this. I didn't know if I would ever see a case at the time. Of course, being a gay man myself, I wasn't sure if I was at risk. So, but by a coincidence, really, we began to start seeing people with HIV. No one wanted to take care of these people, and my business partner, Thomas Klein, and I just started to see patients because no one else would do it. And that's how it all began. Yeah, I'm publishing a memoir. It's being published by the University of Chicago Press in May of 2020. It's called Plague Years, A Doctor's Journey Through the AIDS Crisis. This is something I've been thinking about for many, many years. There have been books written about HIV, obviously. Some quite prominent people have written books about this disease. I didn't think there was necessarily a room for another memoir, but many years have passed since most of these books have been published, and HIV has changed. I mean, most of the books that have been published about HIV have been published before the mid-1990s. And although AIDS is still here, it's changed. And so I thought young people especially don't have much knowledge of HIV/AIDS, and even those people who are taking PrEP, which is the pre-exposure prophylaxis against HIV, have not experienced HIV themselves, do not know anybody who's had HIV/AIDS, and don't always know how awful a disease it can be. And I thought there was room for another memoir about this infection. In terms of being a primary care practitioner, most primary care practitioners are not going to be taking care of people with HIV. I happen to be a primary care practitioner, and the only reason why I'm doing this is that I got swept up in the epidemic at the very beginning. But I think most people today who are primary care practitioners are not going to be taking care of people with HIV because you have to have an expertise in doing it. You have to see a lot of people with that disease to feel comfortable taking care of them. So most people these days are being followed by infectious disease specialists who have more experience. But that said, there's still a number of us who've been doing this for for decades that will continue to do this until we retire. But so in trying to answer that question indirectly, it has no bearing on me as a primary care practitioner, but as a specialist, it allows us to have a wide range of medications to prescribe to people. So today, unless someone really messes up their treatment plan, there's no reason why we can't find a regimen that should work. So we have, as you say, 45 medications or so that can be used to treat people. HIV there's no reason someone should remain detectable. That is, the virus should be totally suppressed by whatever regimen we choose to find, if that makes sense. Yeah, how we treat people with HIV has evolved, obviously, over the decades. Initially, in the 1980s, we had nothing to give people. Then AZT became available, and we were using what was so-called monotherapy, like one drug at a time to treat someone. That turned out to be ineffective. And then by the mid-1990s, we suddenly had these so-called cocktails, which were multiple, like a minimum of 3 medications that one could use to treat HIV, modeled on treating tuberculosis, which is also treated with 3 drugs. So suddenly we had medications that we could use that were very effective at controlling HIV. So, and since that time, the treatment has become even simpler. People used to take 15, 20 pills, not only for their HIV, but to prevent opportunistic infections, as they're called. But now we actually have, for most people, we can find a single tablet, which is pretty remarkable. I remember having a patient tell me that he couldn't believe it. He said, this just doesn't seem right to me. One pill, how could that be? But it's true that we can now, for many people, just do a single tablet regimen, simplify their treatments. The side effects are very few. So people can be on these medications for decades and not have any significant side effects whatsoever. Whereas the older medications were not only burdensome, but also had some unpleasant side effects in some people.